So good morning, good afternoon, everyone. I turn my camera on. Welcome to today's member learning session hosted by Child Helpline International. My name is Laura Holiday and I'm the learning manager here at Child Helpline International. And I'm joined by my colleagues. I see Ronya, Senior Manager Program Development. I see Ale, our Project and Comms Coordinator, and Helen Mason, our Executive Director. And we're really pleased to welcome you to this important session. This webinar is part of our ongoing commitment to member-led learning and peer knowledge exchange, and it's outlined in our learning strategy. And today's topic is measuring the impact of child helplines. And this is one of 6 learning priority topics identified by you, our members, and it's a timely and essential topic for all of us. And as many of you know from your own context, assessing impact of child helpline services is particularly complex for the reasons that your contacts are often anonymous or one-off and concern sensitive topics with a lot of identifying details. So in today's climate of shrinking funding, being able to demonstrate our impact is more critical than ever for funders, policymakers, and our own internal learning. And in this 1-hour session today, we're going to dive deep into how child helplines have approached impact measurement in their own way through a presentation of research conducted by Child Helpline International back in 2021. We'll also be learning from 2 child helplines, which is Kids Helpline in Australia and Smile of the Child in Greece, on how they have approached impact assessment. I'd like to highlight that this session serves as a space for reflection, shared learning, and open discussion about the barriers to measuring impact. So it won't come with all of the fully baked answers, but we'll be focusing on collaborative exploration and drawing on the experiences that you've all shared on this topic. One final note, this space is, as I mentioned, it's intended for our member Child Helpline. So if you're a partner, we kindly ask you to lead the session. So that, yeah, thank you for your understanding. So I'm going to introduce our speakers, and I'm honoured to welcome them all. Just very quickly, we have Lorleen, who's our research consultant at CHI. We also have Konstantina Morphy, a psychologist at the Smile of the Child in Greece. And we have Tonya de Brown, who's a performance and evaluation manager at Kids Helpline Australia. And before we leave today, we'll have some closing reflections from our own executive director, Helen Mason. Just a last few notes before we begin. We are recording this session and we will share on the learning platform afterwards. We'll reserve some time towards the end of this session for both pre-collected and live questions. If anything comes to mind, please feel free to drop them in the chat. And as you listen today, we invite you to reflect on your own Child Helpline's approach to impact assessment. What's working, what's challenging, and what support do you need? So with that, I'm happy to hand over to our first speaker, Lorleen, who will walk us through CHI's impact assessment research. Dr. Lorleen Farrugia is a BPS chartered social psychologist specializing in child protection and child's rights research. She is head of research at A1 Research, where she consults with international organizations to advance child-centered approaches for advocacy and evidence-based interventions. She has been working with child helplines and hotlines to advance quality and accessibility of these services. Lorleen, warm welcome, and I hand the floor over to you. Thank you.
Thank you so much, Laura, and thank you everyone for being here. So I will, as advertised, I will be presenting some of the research that we have carried out with our helplines, focusing specifically on impact. And as Laura said, I'm afraid we don't have all the answers, but we hope to provide you with some food for thought and perhaps further reflection on measuring impact. So, okay, you should be able to see my slides. Measuring and assessing impact. We know it's challenging, and it's specifically challenging because, of course, by default, helplines are providing valuable but often anonymous, short-term, and remote support with often very limited possibility for follow-up. But of course, we know that measuring and assessing impact is very important. First of all, because of the way we want to provide our services in a relevant, reliable, and of course, quality-oriented way. And demonstrating impact is one of the ways that helplines can advocate for sustainable funding. So this is why also we are looking at this important topic. When it comes to the specific research, it was aimed to understand Child Helpline's approach to assessing user satisfaction and the impact of our services. It was a mixed methods approach to the study. So we carried out interviews and surveys with 9 helplines between August and November 2021. Now, keep in mind, here we are speaking of helplines that the majority of them offer services through phone and chat services, but they also use other platforms which children can use to contact them. So it's not just phone and chat, but various other services, including email, social media, forums, and mobile applications as well. In terms of assessing impact, it was a need that was felt by all child helplines. But not all child helplines were happy with the systems that are in place that they have for assessing impact. So in terms of the systems in place, not all child helplines have such systems in place, but an interesting and perhaps something to get us started is also the reflection that even when impact assessment is not formal or methodical or consistent, there are still means to assess impact informally. Obviously, we're looking at developing this, but if this could be the informal impact assessment could be a starting point. Looking at the letters refer to the different child helplines. So we have a variety here of ways in which impact is measured. So it could be often either the child helpline professional or volunteer who is supporting the child, who gathers feedback during a conversation. But we also have the majority of helplines here having individuals specifically focusing on carrying out evaluation, measuring impact or quality assurance, so monitoring, evaluation. Some helplines also employ independent researchers to carry out impact assessment and research impact, and some others have child helpline professionals within the child helpline who are focusing on measuring impact. Then we have some feedback conducted or impact measurement conducted by student researchers, while some others also collect spontaneous feedback from callers as a way of measuring impact. So this is a bit of an overview. And when we think of impact, I want you to think about ripples. And you might say, what is she going to go on about? But yes, I'm thinking of the ripple, whereas layers of impact can be considered like the different ripples. So let's start from the center. So when you drop a pebble in a pond, you first start with the immediate impact and the smaller circle, which that is focusing on the immediate outcome. So that is an outcome such as obviously supporting, protecting, and empowering the child, calling the helpline, contacting the helpline. So here we have the center of the ripple, where is the immediate impact. Of course, it also implies timely responses, a continuity of service provision, but then we start getting wider and we look at the intermediate impact. The helpline, through understanding how it is supporting children, the helpline has a unique point of view. There's the possibility of becoming even closer to children. There's a normalization of help-seeking behavior. The helpline responds to trends. We had just conducted this study after the pandemic, and a lot of participants were telling us, because of the data that we had from the child helpline, we could act fast and respond to children's needs, filling in specific gaps. Then we also have the wider, so the ripple gets wider, okay? And we have children's voices there, the long-term outcomes. Children's voices could be used for evidence-based advocacy. There was less stigma in help seeking, and of course, policy developments. So here, obviously, the long-term outcomes are more difficult to measure, but we could see that some participants were especially focused on the immediate outcomes, a bit less participants focused on the intermediate and fewer on the long term. But as we can see here, we have these different layers of impact. So if we think of the ripple starting from the center and keeps getting wider and wider. So there are various types of impact that we can think about. And there I pose the question of what is success? So these are two different quotes that are coming from the participating helplines, where we have success from the counselor's point of view is having time for going through all the motions to support the child. For children, it means that after the call, they have more hope, perspective, ideas for solutions in comparison to before. So that is one point of view of what success means. But then another quote, which I thought is also quite interesting, that success can be considered a problematic term, a problematic word. For instance, when you remove a child from their family, it is a trauma. Does this mean success? So even if in the eyes of the helpline, that is a sign of a situation that has improved, it can still be traumatic for the child. So here we're looking at what we understand with success can be a bit complex as well. So moving on to different ways of measuring impact. 3 of the participating child helplines have a systemic way to obtain feedback from every child who contacts the helplines, but it's not the only way. So other child helplines could only obtain feedback from a sample of children. Some said we can do this only at a specific time of the year, and some other gather feedback only sporadically. So here we're looking at both informal or unstructured ways of measuring impact, and also some other formal ways. So some of the informal ones would be the spontaneous feedback that helplines receive. So, and of course, this is something that is very welcome by feedback by helplines, because they get some insight as to how children feel. When children end the call, you might think maybe this is strange, but of course, you know that sometimes children are happy with the response that they get, and then from their end, they feel that it's time to end the call. When children call, repeat callers when they call again, and sometimes when they refer others. So helplines feel that these are informal but still significant ways of understanding the impact that the helpline is having. And then there are the more formal or structured ways. So the systematic feedback, as I mentioned, asking questions systematically to each and every participant, but we know this is always possible, asking participants at the end of a contact, either on the phone or if they're on chat or text, using surveys, so worldwide, nationwide, sorry, surveys that would be trying to capture impact through the experiences of children and young people who have contacted the helpline when they were younger. Criteria to ensure quality. I'll talk a bit more about this because we have a specific section on that as well. And then, as I mentioned, having either dedicated staff or volunteers and stakeholders who are also asked for feedback to increase the understanding of impact. So some ideas from the child helplines. Some helplines ask direct questions during the conversation, at the end of the conversation, asking something like, has the conversation helped you? Or looking at a before and after. So looking while the counselor is speaking to the child whether there is any change in how the child is feeling, or maybe has the child gained a new perspective. Also gauging learning, trying to understand what has the child learned, and a forward look. So understanding also what they plan on doing after the call. And some helplines also use a child-friendly way of understanding impact by asking them to give a school grade to the conversation. So how has the helpline fared in supporting you? Here, I want to pose some information about surveys. So this particular helpline asks young people who have contacted the helpline earlier on regarding their experience with the helpline. So here we have an evaluation of service users, and it is promoted on their website, on social media channels. When children make contact, they are asked to fill in the survey anonymously, and it's done. It's one of the ways in which helplines address the issue of anonymity. They make this information about the survey public, and asking anyone who has contacted the child helpline to fill in the survey. Of course, we started mentioning the challenges. We know the anonymity is a major issue, also the one of nature, but also sometimes the timing and the workload of the counselors. Some counselors said it's very difficult to ask children who are vulnerable or are in distress to give feedback about the service, especially if this is something that's still unresolved or still in a vulnerable position. So here that the participants mentioned the ethics of asking questions about impact, and in terms of resources, so the workload that counselors have, they were mentioning that it is important to have enough time to allocate to providing the service. So sometimes impact assessment gets lost in the midst of many other things that the counselors at helplines have to do. In terms of the challenges, even in the survey, we see that we have anonymity and the one-time support as the major challenges. But then we also see some other things like the lack of technological tools or the lack of financial resources. That's a consistent issue. But also in terms of what I was mentioning before, the helpline's priority is to offer immediate support to the child. We have various things to look into, but we can also look at sometimes lack of knowledge and skills. So here we're looking at possibility of looking into training, into how to ask specific questions that, while not maybe necessarily measuring impact directly, they can give us insight into how the helpline is doing in supporting children. Of course, resources are important. So we have here what helplines mentioned in terms of increasing the availability and accessibility of services to ensure that they can be impactful. So they mention human resources, but also the availability of the service for longer hours, offering support in different languages using different modalities, and also the issue of financial resources. And this is a bit of a circular thing. So being able to demonstrate impact can also support with funding applications. And of course, having more funding will increase the helpline's possibility of measuring impact. So this goes a bit in this way. In terms of other things that participants mentioned is how they use quality to try to achieve impact based on quality. So going beyond data, so trying to look at different areas of impact. It does not have to be a survey, but as we've seen and will see in the list of good practices, some ways that helplines try to use to measure impact. Having the right employees or volunteers is also important to delivering quality and impact work. So with the right motivation, the psychological readiness, and also training, consultation, and supervision. So not just the initial training, but ongoing CPD, peer supervision, case reviews, and so on. And some helplines also think of using protocols and standard operating procedures to ensure that the contact is being supported in a way that ensures impact. And to conclude, some good practices. So, adapting according to the modality. So, finding different ways of measuring impact based on what type of channel is being used, whether it's a phone or a chat. So, having different ways in place. Facilitating feedback submission. So, the spontaneous feedback happens, as we're saying, spontaneously, but when helplines have ways in which feedback can be submitted easily, it's also developing that aspect, asking for feedback, but also analyzing the available data, including indirect measures of success. Referrals can be a bit difficult, but some helplines also mention that a way of assessing impact is to follow up on referrals and look at the case management process. Training on impact assessment, that is something that is also an aspect that can be developed, sorry. The focus on short-term, intermediate, and long-term outcomes, and perhaps identifying. We mentioned we've had also some thoughts about having monitoring or evaluation instances. So here we would be looking at what are the short term, what are the intermediate, and what are the long term outcomes that a helpline is trying to achieve, and understanding how to measure those, involving different stakeholders. We mentioned the surveys and qualitative study to measure user satisfaction, specific roles within the helpline, focusing on measuring impact. So also the possibility of having the counselors being focused on the task of counseling, as we're mentioning, but also perhaps having individuals whose role is specifically focused on measuring impact. And then identifying different ways to disseminate the impact to ensure that it can be tailored to different stakeholders. So funders might want to see the data in a particular way. So this is also part of the skill in learning how to develop that data, that information, in order to disseminate it to the relevant stakeholders. So that's it from me for now. And yeah, thank you for listening. And I'm curious to hear your reflections and questions.
Thank you so much, Lauline, for the very thorough presentation. I really enjoyed listening to you. And I hope for everyone it illustrated just how complex and diverse some of the barriers are that you're facing to impact assessment, and how different child helplines in that study have interpreted what impact assessment and success looks like. That was really interesting. The study is available in full on our e-learning platform. I will be resharing the link after our webinar today. For now, we'll head over to our next speaker, Konstantina Morphy from Smile of the Child. And I'm going to share with you Konstantina's biography. So she completed her undergraduate studies in psychology at the National and Kapodistrian University of Athens, followed by a postgraduate program in clinical mental health at the Aristotle University of Thessaloniki. She's currently also in training as in psychoanalysis. She works as a psychologist in the organization's helpline and support services, and provides direct assistance to children and individuals in need. Konstantina, I hand over to you. Thank you very much.
Thank you. Can I share some slides in the screen?
Please.
It's okay, can you see them?
Yes, thank you.
Okay, thank you. I will start, let me begin by explaining how the Smile of the Child was founded. It was founded by the 10-year-old Andreas Giannopoulos, who expressed in his diary the desire to create an organization so that all children could have protection, love, affection, interest, and respect. In our support and helpline center, we provide access to several specialized helplines that operate both on a national and European level, offering assistance to children, teenagers, and families in need. First, the National Child SOS Line 1056. It's available 24/7 to support children who are in danger, in need of protection, or simply seeking someone to talk to. Then we have the European Helpline for Children and Adolescents, which offers psychological support, guidance, and information to young people across Europe. We also operate the European Hotline for Missing Children. And finally, there's the National Helpline for Missing People, which serves as a point of contact for families and individuals seeking help in locating a missing loved one. Moving on the next point, I would like to say that all the lines are free of charge. They're available every day, 24 hours a day, all year round. The maximum waiting time is just 8 to 10 seconds, so people get help quickly. They also connected to the European emergency number 112 for better coordination at cases. There are also 8 connected call centers in different cities. We also work together with the organization Social and Medical Emergency Response Centers, which operates across Greece. And finally, there's a special emergency call center located at the disaster recovery area at Eleftherios Venizelos Airport. Now, I would like to focus on some of the statistics of our organization. I'm gonna make a brief report. We supported approximately 100,000 children in total, which is about 266 children each day. We answered approximately 200,000 calls on the 4 helplines, about 513 calls every day. Every 3 days, we help or got reports for two children about sexual abuse issues or facing bullying. We helped or got reports every day for 7 children who suffered physical, emotional abuse or neglect. Also, every 3 days, we helped 2 children struggling with thoughts of suicide. Every school day, we reached 228 students with prevention programs on violence, abuse, bullying, missing children, and running away. Every day, we also transported 10 newborns or children to hospitals. We gave medical and dental checkups to 28 children. We answered 27 requests for children with health problems, and we helped 42 children with tough living situations and their families. And last, every 3 days, we search for 2 missing children, and every 2 days for a missing adult. And every 2.5 days, we did an one-side intervention for a child in immediate danger. It's important to highlight that one of the most important tools of the organization is the TAT 1056 application, which is a part of the National Helpline SOS in Greece and provides a safe and anonymous and free way to children to communicate through text. So it offers a trusted support anytime, anywhere, from any device. The app builds trust that encourages children to share all kinds of issues, from simple problems like family conflicts to serious concerns such as suicidal thoughts or violence. So many children find it easier to open up through text because they feel safe to express themselves without fear. By giving children a private space to speak and receive advice, chat becomes a vital line, helping them before problems escalate. Before starting the chat, children fill in a field describing exactly how they feel before the chat. And this helps us see how their emotions change after the conversation and shows how our support can improve their mood and well-being. What is particularly significant is that the smile of the child knows how important schools are in preventing problems. So we keep in touch with schools and offer activities for students, teachers, parents, and guardians. And these activities can happen in person or online as live lessons. And we have a special team of psychologists leads these sessions for all ages. They are free and available all over Greece. Also for online lessons, they use their own WebEx platform or the school's platform. Also, there's a survey from Focus Barry, which conducted in November 2022. And as we can see, the Smile of the Child has been recognized as the most trusted non-governmental organization in Greece. And these results highlight the organization's significant impact and the public's growing trust in its services, including the 1056 helpline, which plays a really important role. And last, on our recent visit to Alexandroupoli, the Smile of the Child worked together with local services like health teams and schools. This kind of teamwork or interagency collaboration helps us in some way understand what children really need and how we can support them better. What I'd like to point here is that when different services work together, our impact becomes stronger. It's not just about answering a call, it's about preventing problems and building, of course, a safer environment for children. And that's the end.
Amazing. Thank you so much, Konstantina, for sharing with us all of the amazing work that you've been doing over the last few years, particularly on impact. Thank you. I'm conscious of time, so I'm going to jump over to our next speaker, Tonya de Bruin from Kids Helpline in Australia, and I'm going to read for you Tonya's biography that she shared. So Dr. Tonya de Bruin has worked at Your Town or Kids Helpline in Australia for the past 4 years. Tonya leads the performance and evaluation team and is responsible for data, reporting, evaluation, and research within Your Town. Tonya is passionate about improving the lives of children and young people to create greater equity in their access to services and also to reduce the impact of societal issues such as mental health. Prior to working at Your Town, Tonya worked with the health industry with roles in health planning across primary, secondary, and tertiary areas, and is currently a board member for Southwest Hospital and Health Service. Tonya grew up in a small country town in central Queensland and has a love for rural and remote communities. And finally, she has university qualifications in information systems, health service management, finance, and accounting. Tonya, welcome, and I hand over to you.
And can everybody hear me?
Yes.
Yes, thank you. Okay, so the Kids Helpline is the, sorry, I'm just getting my navigation happening. I'd like to start by acknowledging our traditional custodians here in Australia and the Yagara Turrbal people specifically here in Brisbane, whose lands that I meet on today. And I'd like to pay my respects to their elders past, present and emerging, and recognise that our lands have not been ceded here in Australia. With regard to how we measure impact within KHL, a bit of background about KHL. So if our clients are children and young people aged 5 to 25 years anywhere in Australia, our counsellors are mostly part-time, no volunteers, and we use a structured case management approach. We're open 24/7, 365 days. We use phone, web chat, and a little bit of email, and we also have a website. In regards to enabling outcomes, we actually look at planning through a theory of change and our program logic. We look at results areas through a concern classification, and we use processes such as counting rules, which I'll just give you a bit of an overview on. And our outcomes, we have direct outcomes that we get via an annual client survey. So we do that once a year, but and I'll show that. We also regularly touch bases with our counsellors and staff through a survey, and we're just about to embark on using something called the Personal Wellbeing Index within some of our repeat counselling sessions. So this is what our theory of change looks like. So we look at the challenges and opportunities, and we set out what it is that we're aiming to do, and then how we think, or what we think that it'll lead to. So we're looking at young people being empowered to be able to self-help. We look at them being able to seek that help when they actually need to, in a way that makes sense to them. And we look at trying to optimise their well-being and safety at any time of the day or night. We have program logic, and we have one that is focused on our phone and our web chat channels, and you can see we've got outcomes that we define on a short term, a medium term, and at an impact level. So focused on early intervention and children taking that responsibility for themselves and being enabled to be able to do things for themselves. And we also then, when we're looking at our voice and our web chat channels, again, we're looking at things like physical safety, increasing the achievement of their goals if they're longer term clients, looking at emotional safety, their service experience, and so on. All of this underpins the way that we actually go about our service. So sorry, I just go back. So on this screen, these are our counting rules on the right-hand side, and this is how we get the demand coming through, and then we break it out so that we systematically count things so that we can compare them over time and get more meaningful results. So we have things like phone inbound demand channel, early dropouts, so people who don't stay on the phone long enough to be answered. And then we look at our answerable calls, how many of those we actually got to, and then it filters down to counselling support and information and referral type supports. All of this diagram here goes to support the production of our reports. So we have an annual report that we do called our Kids Helpline Impact Report, and that is where we report our basic statistics that we capture. So some snapshots of that particular diagram shows the key impacts in 2023. We try and make it visual and appealing so that it resonates with children and young people. And we also have it available on our website so that if people want to go there and access it, they can download it from the website quite easily. And you can see some of the numbers of different things that we're doing. And we do this each year at the end of the we have one report that we do at the end of the calendar year and one report at the end of the financial year. We also have a concern classification, and the concern classification allows us to categorise the content that the counsellors capture in a structured way so that we can use that to drill down and find the areas that we're impacting on the most, and then specifically what it is within those areas. So here, if you see, we look at child abuse and family violence, and then we look at subsets of that. So was it exploitation by a family member? Was it emotional abuse? Was it from living in care? And that allows us then to actually target campaigns, but also to feed different sets of information. So we provide information through to the Australian Federal Government. We also provide information through to the E-Safety Commissioner and different government groups like that, so that they can use the data that we have to change the way things are approached. Or we did a lot of work with the Australian Federal Police with on extortion, for example, because we were seeing trends that were raising or rising, particularly within boys between 14 and 17. So we do a lot of advocacy using the information that we gather. We also have what we call our KHL outcome classification, and that's where we try to look more specifically at the outcomes as opposed to the concern types. So building awareness, growing new knowledge, building relationships and social connections, and so on. And that allows us to, again, understand how we can help young people through, particularly the ones that come back with repeat contacts. Some of the questions that we ask, this is our annual client survey. So some of the questions that we ask is, to what extent does the counsellor make them feel heard, respected, understood, talk about the things that they wanted to, that it was a good fit. So we're really here that the children and young people are telling us what they think of our service and the impact that we're actually making on them, in terms of whether they needed help anymore, whether they found what they needed, whether we actually changed the way that they were feeling after the contact. This particular survey, we've in the last 12 months, we now keep it open all year round, and we just report on it once a year. But at our latest count this year, we've got over 6,500 partial completions or full completions for this particular calendar year. And so there's over about 2,000 of those are full responses. So that will inform our survey, like our learnings from this year. We also have, through phone and web chat, we break contacts into whether they're a first contact, whether they're occasional support, or whether they're ongoing support, or whether we don't know. And then from that, we know, and we can build stronger relationships with the occasional supports when they turn into ongoing support. And we also track things like what time of day things happen and whether they're the same. So the teal is the phone and the orange is the web chat. So we have lots of other things that we track as well, but this is particularly useful for being able to help people with more systemic issues in terms of that ongoing support. And the PWI, so the Personal Wellbeing Index, is something that we're introducing at the moment for those regular clients. And the PWI has been developed by Deakin University to look at measuring subjective wellbeing. So the young person themselves complete this survey, and they do it 3 months apart, and we look at the change that occurs between point A and point B, so that we could actually then try to determine which of these things are we actually impacting on the most. And through this process, we're also looking at using the Green Book and being able to quantify that. So turning these responses into quality of life years, and then being able to determine a financial impact from the change that we've made. That's a work in progress at the moment, and we're not where we're at the early stages of this sort of progression. But we're very excited about what we could potentially achieve. The other thing we do is we also work with other organisations in terms of research. And so one of the big research projects that we've done over the last little while, and it's still continuing, is with University of Sydney, and looking at counsellor and crisis support wellbeing, because obviously the better the wellbeing of the counsellor, then the better the impact with the young person. So it's kind of a two-pronged approach. And I've put a link in the bottom here that takes you through to an article that Jaden's written, that walks through what they're finding through this counsellor support wellbeing. And we've got some specific data that's relevant to our KHL people themselves. And so we got greater insights into our own staff and the things that impact on them. The other thing that we do is we have, this is a partial screenshot of our performance dashboard. So we provide a lot of feedback back to the counsellors in near real time so that they know how they're going within their teams and with their workloads, and so that the team leaders can provide better support to the counsellors that they have within their teams as well. And in doing that, we actually improve the satisfaction of the counsellors, and in that way we're able to influence more young people because we have happier, healthier counsellors who feel supported. And so that's so we don't just look at the impact on the young people, but we look at the impact on our counsellors and their working environment, and provide this information so their team leaders can be as effective as possible. And so that's the key slides that I wanted to share. And just to give you a bit of other context, Kids Helpline's been around for just over 30 years now, and we're expecting to have our 9 millionth contact in September this year. So it's a long-standing service. And yeah, I think the challenges that we face with collecting impact is the diversity of it and making sense and trying to get it as real time as possible. And but we find that the young people that use the service are very keen to provide us with the feedback. And so we will be also moving to 3 short questions at the end of each contact if they want to respond to it.
Excellent. Thank you, Tonya, for this extremely thoughtful and informative presentation that you've prepared. I really enjoyed learning from you. And I want to thank you both as well, Konstantina, for sharing with us the variety of data collection opportunities that you've put in place, and how you both have really interrogated all of the information that you're collecting to share it with the relevant networks and partners that you have locally to really expand on the work that you're doing to support children and young people. We now have around 10 minutes for questions and answers, and I'd like to invite you all to share any questions, anything that comes to mind in the chat. And again, re-emphasizing that this is a shared space for explorative learning. I would first like to go to Bhavna. Bhavna, if you're here, you have a question, I believe.
Hi, Laura. Can you hear me?
Yes, I can. Hi, Bhavna.
Hi. Thank you, guys. Thank you, Lauren, Constantina, and Victoria for your presentations. It was very insightful. I just want you to check in. I know that Tonya in her presentation mentioned a slight comparison between online counseling or web chat versus telephone. Did any of the other research look at the impact of online counseling versus traditional helpline methods by telephone? Thank you.
So I don't know if anyone would feel comfortable answering that, but the question was from Bhavna: did your research explore the impact of online counselling versus traditional phone-based counselling? If any of you have experiences on that topic. Lorleen?
I saw Tonya speaking, but you're muted, Tonya.
Yeah, sorry. It's because I've got a bit of a cough at the moment. I didn't want to be coughing online. So from our perspective, we do separate between the two. So we have the web-based counselling and then we have the phone-based service. We find within our counsellors, they have a preference to do web-based counselling over phone because they feel more protected in some ways, is what we're finding out. We have also found through the COVID era and coming out of COVID that young people have tended to gravitate towards web chat more. From an organisational perspective, we find web chat takes longer to actually undertake. So we don't get through as many contacts. But if we have escalation and crisis contacts, we always transfer them to phone so that because we find that that's a better medium for having those conversations and for working with young people to de-escalate them from a crisis situation and also to refer to other services.
If I may add something also, we need to think about, I think what Tonya said, that's quite interesting, how the counselors feel they're more protected when they're on the phone. And we need to think also about how it's one thing to speak to someone in person and you have maybe some information, maybe if you're not seeing them, but still they can get a tone of voice and some nonverbal information. But when it's on the chat, we also need to think about learning how to understand better, how to have support and helping conversation. So maybe we might also need to think about training in specific aspects of supporting children in online spaces.
Excellent, thank you both. And I see a question that's come up in the chat from our colleagues in Singapore. How does training for impact assessment look like? And not only to our speakers, but to anybody else participating in this webinar, please feel free.
I don't know if anyone wants to share. Yeah, Tonya.
I was going to say, so in my team, we're the ones that actually do the evaluation or prepare the surveys. And so we don't necessarily train the counsellors for doing that themselves, but they do actively participate in the design of the tools that we use, and they actually actively participate in completing surveys. I think we had 75% response rate from our counsellors in the last impact survey. We also actually have a youth group within your town that young people come together and design things specifically for capturing impact and providing feedback back to us. And we run a separate survey about what young people want to see and how they can be helped with different aspects.
Excellent, thank you, Tonya. I see a question in the chat saying, were children asked directly after counselling how they would rate the counsellor/counselling?
Yeah, that's one of the three questions that we've just changed over our technology base that supports the phone contacts in particular. And one of the questions that we will be asking at the end of each session is, we're proposing three questions. One is the level of satisfaction that they've had with that particular contact, whether they're likely to use us again in the future if they needed to, and whether they are likely to refer us to a friend or someone else who may need us too. So they're the three questions that we're going to be focusing on. And for the minute, at the end of the contact, they actually get linked to the annual survey that's actually available to them, and so they can go on there and then they can complete, and that gives them a whole range of questions about whether they felt supported by the counsellor and what the content was and things like that. So it's quite an extensive survey. And as I said, we've got over 6,500 partial or 2,000 complete responses.
Excellent. Thank you for that, Tonya, and great question, Melissa. See the Domitilla has her hand up. Please go for it.
Thank you, Laura. This is Domisile from Childline South Africa. Just really to appreciate the presentations that we have received, really useful and impactful. I just had some questions specifically for Tonya, just really to appreciate the wonderful work you are doing in Australia. So I
Thank you.
just wanted to find out how many contacts do you receive per year, looking at different platforms, obviously. And from what you have shared with us, I believe you have really done a lot of work over time to be able to establish such strong systems where you're able to extract and share information. So maybe, I don't know, Laura, it feels like we probably need another session just to understand how Australia has come to where they are now. So maybe just more information around how have you been able to establish such strong systems over time? And lastly, how have you structured your team? And who are the key personnel, even behind the scenes, that one would need to look at in order to be even able to come close to what you guys are able to do in your country? Thank you.
Thank you so much for the feedback and for the question. To give you an idea, in 2024, we responded to over 130,000 contacts. 75% of those came in outside of core business hours, so outside of 9 to 5. Of those contacts that we responded to, 75,000 were counselling sessions, 4,500 were crisis interventions, and 3 out of 5 covered mental health, emotional well-being, and suicide. So it gives a bit of a spread. But in the slide deck, and I'm happy for to circulate the slide deck, but in the slide deck, there's a link to, we do have our impacted reports and so on the Kids Helpline website, so that you can access them through there and see those. In terms of the team, we've got KHL counsellors in 3 different locations across Australia at the moment. Queensland is our major site and the original site, but we also have a presence in Blacktown outside of in Western Sydney, and also in Victoria in Melbourne. Those 2 centres are quite new. New South Wales started at the beginning of COVID, and Victoria started about 12 months ago. We are the staff that we have, we've got a lot of staff who have been with the service for a long period of time, like 20, 25 years. It's crazy how long people stay and how dedicated they are. Most people are part-time, they don't work full-time. They're broken into teams, and the teams have a team manager, so they're supported really well through that process. They also have, in addition to a team leader, they have a shift supervisor. So the team leaders work on the personal type of things, and the shift supervisors run the shifts. So there's a different strategy across those. And they have, we also use, we have a team that does practice supervision, so they help the individual counsellors to maintain their own personal well-being and safety, and they can debrief with those services. How did we get there? I think, look, we've got a fabulous team that's worked tirelessly all the time. So my team sits outside of KHL itself, and we work across your town with lots of different programs, but I've only got a handful of people, and we're very passionate about how do we listen to the data so that we can tell the story of the data? And so what we produce is driven by the data that itself. We don't. We also work closely with our media advisors, and they will come to us and say what's important for us to push out into the media. So when the sextortion stuff was escalating, we were running a lot of campaigns that were drawing attention to sextortion and the issue, and as I said, teaming up with people like Meta and the Australian Federal Police to take targeted action against specific areas. We also support things like Dolly's Dream, which is another charitable organisation that has a helpline. Dolly was a young girl who committed suicide at the age of around 12. And so her parents have established that. So we work with other charitable organisations to form those connections. We have days, like we're going to have a 24/7 day on the 24th of July to draw attention to the things. So we have a strong presence, and we're one of 4 organisations that the Australian government has as their they call it their mental health safety net, if you will. So we're all charitable organisations, but we're the key providers in terms of that 24/7 free service that for us it's just children and young people, but for some of the other services it's adults in crisis and other things like that. And so we work closely with those organisations as well, albeit you could say that we're competitors, but we don't work like that. We work collaboratively to address this. We also have a complementary program. So we have a program called My Circle, which is an online chat forum that young people can use. We have Kids Helpline at School, which is again an offshoot of KHL, where we've got specific 1-hour sessions that have been developed and designed initially for primary school, but increasingly for high school, where teachers can book a session and a counsellor goes into the school, generally online, and conducts a session, like an awareness session for the children and young people. So I think we spend a lot of time building complementary services that extend upon each other, but actually reinforce the same messaging. And a lot of it is about how do we empower young people and give them a safe space so that they can help themselves. It's not about creating dependency on us. It's about us enabling them to become to address their own needs and to find the information on our website that is helpful to them, or to talk to people who will take them through something. So I think we're not a crisis service, albeit some young people do contact us and they are in crisis, but that's not the main aim for us. The main aim for us is really to provide a supporting and safe environment where young people can learn to help themselves and find reliable content. And yeah. Sorry, that was probably a long answer. My apologies.
No, it was brilliant. Thank you so much, Tonya. I think we'll have to call that as the last question of the day. Thank you, Demisila. I'm conscious of time. So I would like to invite you all, if you have any continued questions for our speakers, feel free to email them to me and I'll make sure that they reach the right people. I very much welcome that. Before we wrap up, I'm very pleased to hand over to Helen Mason, our Executive Director at Child Helpline International, for a couple of closing reflections. Please, Helen.
Thank you, Laura. I don't think I've spent an hour doing such valuable work for quite some time. We've squeezed so much into that 1 hour, and I'm very, very grateful for all the inputs from you, Laurleen, from you, Constantina, and from you, Tonya. Very rich, very valuable information has been shared here. I think the whole gamut of information around the systems, the processes, the organizational build-up, the organizational readiness for this work has been very well articulated. So with thanks for presentations, all of the information, I think I wrote down in big words, inspired. I'm very inspired this morning to continue this discussion of the international consultation, where we'll meet in 4.5 weeks with many of you. Very excited. As Ronya said, we have a session on impact assessment there in Zambia. So we'll be looking forward to that session. And I also wanted to capture a couple of key things that came through the presentations. I think, you know, the diversity of information and data that's been collected as part of these assessments is really vast. And I think making sense of that is a very important aspect. I think, Tonya, you highlighted that very well. The importance of partnerships, both in gathering the information, but also in sharing the information, especially, you know, when emerging trends or information that can inform policy and program came through very clearly. I think that for me, you know, we commit to hosting these sessions, to continuing these conversations. They're very important to us as well. And I'm sure that everybody on this call today is very fired up and, you know, busy thinking how to apply some of this to their own work. And I'm also very conscious of what we can do when we accumulate this information from you, our members. So the cumulative impact of your impact assessments is something that I'm very excited to explore. So let's please continue this discussion. I want to thank you again, Lorleen, Konstantina, Tonya. Thank you also to you, Laura, for your ongoing amazing preparation of these very valuable sessions together, and wishing you all a very wonderful rest of the day. Thank you.
Thank you.
Bye, everyone.
Thank you.
Thanks, everyone.
Thank you.